Let's explore the differences between therapy, mentorship, coaching, and psychiatry. I know. So many terms, right? And they all seem to offer help or guidance in some way, but what's the difference? How do you figure out which one you might need? Well, sit tight, because by the end of this video, you'll have a clear understanding of what each of these services is, how they differ from each other, and most importantly, which one might be the right fit for you at this point in your life. So what exactly is therapy? The word gets thrown around a lot, especially nowadays. Therapy, also commonly referred to as counseling, is a process where a trained professional helps you navigate and work through emotions, behaviors, and thoughts that might be causing you distress. Think of it as a journey inward because therapy is all about deeply exploring your feelings, experiences, and mental health. Unlike simply talking to a friend or a loved one, therapy introduces you to evidence-based techniques and methods aimed at promoting emotional well-being and mental health. When you work with a therapist, you're essentially entering into a partnership with a professional who can guide you through challenges, whether they stem from childhood, recent experiences, or ongoing situations. This is someone trained to help people cope with difficulties that feel too heavy to carry alone. Maybe you've been anxious a lot lately. Perhaps those negative thoughts won't turn off. Or maybe you're dealing with grief, trauma, or just feeling really low without knowing exactly why. Therapy could help. Connecting with a therapist, whether it's in person, over the phone, or online, as many sessions are done nowadays, can offer incredible relief. One key point to understand is that therapy isn't one size fits all. Rather, it's a personal process uniquely designed to address your specific concerns and goals. Not all therapy sessions will be the same even if you meet multiple therapists. Some might focus on immediate issues you're facing right now, like acute stress. Others might delve back into your childhood experiences or recurrent thought patterns to figure out how things from the past felt or that might be influencing you today. Let's talk about some common types of therapy. One of the most well-known forms is cognitive behavioral therapy, or CBT. This type of therapy is based on the idea that our thoughts, feelings, and behaviors are interconnected. By changing the way you think about a situation, you can often change how you feel and behave. For example, someone who has a tendency to dwell on negative thoughts might work with a CBT therapist to reframe those thoughts more positively or realistically. Next, there's psychodynamic therapy. This is an approach that delves into the unconscious mind, exploring how your past experiences, especially from childhood, influence your current behavior. A therapist using this approach might help you uncover deeply buried memories or unresolved conflicts that are still impacting you today. Another approach is dialectical behavioral therapy, or DBT. Originally developed to treat borderline personality disorder, DBT has since been adapted for the treatment of many other mental health issues, especially those that involve self-destructive behaviors or intense, unstable emotions. This approach combines cognitive behavioral techniques with mindfulness practices in order to help clients regulate their emotions and build healthier relationships. And finally, we have family therapy. This type of therapy involves working with families as systems rather than focusing on individuals. A family therapist might work with all family members together or in separate sessions, helping them communicate more effectively, resolve conflicts, or support a family member with mental health challenges. So what's the takeaway here? Therapy is fundamentally about introspection and working through emotional and psychological challenges. It's often a good fit not only if you're facing a specific mental health issue, but also if you want to delve deeper into your life and understand why you feel or behave the way you do. Whether it's acknowledging the impact of past trauma, managing present-day stress, or learning new coping skills, therapy offers a supportive, confidential space to work on you. It's also important to remember that therapy isn't just for when you're in crisis. Many people benefit from ongoing therapy as a form of self-care. Even when things seem fine on the surface, therapy can offer valuable insights and teach you skills for handling life's curveballs. All right, now that we've dug into therapy, let's move on to mentorship. Mentorship is a little different from therapy, though it's often equally impactful. While therapy focuses on understanding and processing your feelings and experiences, mentorship is more goal-oriented and practical. It's about learning and growing under the guidance of someone who has traversed the path before you. A mentor is usually an experienced individual in a specific area or profession whom you look up to. Let me paint you a picture. Imagine you've just landed your first job in a field you're passionate about, but you're feeling overwhelmed because everything is new. The industry jargon, the company culture, the client relations, it all seems daunting. This is exactly where a mentor could come in. Suppose this mentor is someone who's been in the industry for years, someone who knows the ins and outs. They can provide you with valuable advice on how to handle the learning curve and give you insights on potential pitfalls to avoid, or even introduce you to a network of people who could help you advance. Mentorship is a relationship that goes beyond simple advice giving. It's often a long-term development process where both the mentor and mentee can benefit. While you're gaining valuable insights and support, your mentor might also find it rewarding to share their knowledge and witness your growth. But what exactly makes a good mentor? Experience is key, but just as important is their willingness to share that experience. A good mentor is approachable, meaning they are open to dialogue, patient, and respect the journey you're on. They're not there to spoon-feed you, but to help you reflect on your experiences and make informed decisions. Maybe your mentor shares how they handled a difficult project or a failed business venture. It's through their stories, seasoned with real-world experience, that you glean wisdom that books and training sessions just don't offer. Another crucial aspect of mentorship is the feedback loop. A good mentor challenges you to think critically about your choices and offers constructive feedback. Maybe they'll ask you why you made a particular decision or suggest alternative courses of action for you to consider. This kind of feedback isn't just about criticism. It's about learning and growing. What's also interesting is that mentorships can take different forms. Some are one-on-one relationships, while others might be part of structured programs with several participants where you meet with a group of mentors. You might even have multiple mentors for different aspects of your life. Perhaps one offers career advice, while another gives insights on personal development. The point is, mentorship is flexible and can adapt to your evolving needs. One thing to bear in mind here. While mentorship is incredibly valuable, it's not necessarily for everyone at every stage of life. Mentorship is best suited for those who are committed to self-improvement and are willing to actively work towards their goals. For instance, if you're feeling a bit lost in your career or want to accelerate your progress in a specific field, a mentor could be the perfect guide to help illuminate your path. Here's a practical example. Say you're aspiring to move into a leadership role. A mentor who's already in that position, or perhaps someone who has held leadership roles at various levels, can offer some invaluable advice. They might share the skills you need to develop, the common challenges leaders face, how to manage teams effectively, and how to navigate office politics. But beyond just giving advice, a good mentor will also encourage you to think for yourself, challenge your ideas, and hold you accountable when it comes to following through on your goals. So, when should you seek out mentorship? Consider it if you're in a stage of your life where you're pursuing new opportunities, transitioning into unfamiliar roles, seeking to develop new skills, or simply looking to gain insights from someone more experienced. Mentorship isn't necessarily about solving your personal struggles like therapy might be, but it's about learning from someone who's navigated similar waters and can help you avoid pitfalls along your journey. Remember, while a mentor can offer tremendous guidance, it's up to you to take the information and apply it effectively. Ultimately, you're responsible for your own growth. So if you do seek mentorship, be proactive, be curious, and be grateful for the time and wisdom your mentor shares with you. Next up, let's discuss coaching. Coaching is frequently confused with mentorship, and while they share some similarities, they're distinct in significant ways. Whereas mentorship often relies on the mentor's experiences to provide guidance, coaching is a more structured, goal-oriented process that employs specific techniques, tools, and strategies to help you achieve peak performance in various areas of your life. A coach typically isn't there to share their personal experience or tell you what to do. Instead, their role is to partner with you in a thought-provoking, creative process that inspires you to maximize your potential. Whether that means getting a promotion, achieving work-life balance, improving your health, or developing better communication skills. Coaching is essentially about setting goals and creating actionable steps to achieve them. To make it clearer, let's use an analogy. Imagine an athlete working with a coach. The coach may not be the best player on the field, but they understand the game inside and out. They use that knowledge to devise training plans tailored to the athlete's strengths, weaknesses, and goals, helping optimize performance over time. It's the same with life coaching, career coaching, or business coaching. When you work with a coach, you're essentially hiring someone who helps you clarify your vision, align your actions with your goals, and hold you accountable along the way. Coaching is incredibly versatile. Maybe you're looking to advance your career and need help sharpening your professional skills. Or perhaps you're seeking to enhance your personal life by working on your self-confidence, health, or relationships. Sometimes, people hire coaches to help them improve habits or adopt a better mindset. Here's what's interesting. Coaches are trained to ask powerful questions that lead you to your own insights. They provide you with actionable feedback and encourage you to take responsibility for your decisions. For example, a coach might work with you to develop a structured plan for a career change, helping you identify your transferable skills, practice interview techniques, and network effectively. One of the things that truly sets coaching apart is its focus on setting and achieving specific, measurable goals. For instance, let's say you want to lose weight. A fitness coach might help you create a diet and exercise plan that fits your lifestyle. They then hold you accountable, track your progress, and help you work through any obstacles you face along the way. You might be wondering, what do coaching sessions actually look like? Well, they can vary, but most sessions involve assessing your current situation, setting clear and specific goals, and then creating a plan of action. Throughout the process, your coach provides structure, encouragement, and accountability. You might check in weekly or bi-weekly to track your progress and make adjustments to your plan as needed. Now let's look at a specific example. Say you're struggling with self-belief. You want to make bold moves in your career, but you're constantly plagued by doubts. A confidence coach might work with you to identify the root of those doubts and challenge the negative beliefs that are holding you back. They could use techniques such as positive affirmations, visualization, or even role-playing exercises to help you practice stepping out of your comfort zone. Over time, this targeted effort can lead to profound improvements, not just in your confidence, but in your approach to challenges overall. What makes coaching unique is that it focuses on the present and the future. Unlike therapy, which often delves into your past experiences to understand your current behavior, coaching focuses on what you can do now to create the life you want. It's all about actionable solutions and empowering you to take steps toward your desired outcomes. Now, while coaching is a generalized term, it's important to know that there are various types. Some of the most common coaching niches include life coaching, which generally covers personal goals, self-improvement, and life balance. Career coaching focuses on job satisfaction, career transitions, or professional development. Business coaching is aimed at entrepreneurs or business leaders who want to grow their businesses or improve leadership skills. Relationship coaching helps individuals or couples improve their personal relationships through better communication and understanding. And wellness coaching focuses on health-related goals, like improving your diet, increasing fitness levels, or managing stress. Each of these coaching specialties requires slightly different skills and approaches. So when you're choosing a coach, it's crucial to find someone whose experience and area of expertise align with your specific goals. So, when should you consider working with a coach? Coaching is an excellent choice if you have specific goals you want to achieve within a set time frame. Whether it's excelling in your career, improving your personal life, or adopting healthier habits, a coach can provide tailored support, enabling you to get from where you are to where you want to be efficiently. Another aspect of coaching to remember is that it's very much a partnership. Unlike therapy, where the therapist guides you through your emotions, a coach works alongside you, helping you construct actionable plans and strategies. Coaching sessions are typically high energy, solution focused, and motivating, leaving you feeling empowered to take immediate action. We're nearing the end, but we've got one more area to cover, and that's psychiatry. So, what exactly does psychiatry involve? Psychiatry is a field of medicine dedicated to diagnosing, treating, and preventing mental, emotional, and behavioral disorders. Psychiatrists are medical doctors specializing in mental health who can prescribe medication, offer psychotherapy, or combine the two to treat various psychological conditions. Psychiatry is particularly relevant if you're dealing with severe or complex mental health issues, conditions that may require medical intervention in addition to, or instead of, talk therapy. This could include conditions like schizophrenia, bipolar disorder, severe depression, anxiety disorders, or ADHD, where a nuanced medical understanding and sometimes medication are vital components of effective treatment. Imagine someone dealing with severe anxiety. Although therapy might be incredibly beneficial, there could be cases where therapy alone isn't sufficient. Anxiety can have a profound impact on a person's daily life, and when it becomes paralyzing, more intensive treatment might be needed. Here, a psychiatrist can assess the need for medication to help manage symptoms, allowing the person to feel more stable and comfortable, possibly in conjunction with ongoing therapy. Let's break down the roles of a psychiatrist. First and foremost, psychiatrists are trained to diagnose mental disorders. They are equipped to understand complex psychiatric conditions and distinguish them from medical illnesses that may present with overlapping symptoms. This diagnostic capability is critical since accurate diagnosis influences the treatment plan. Secondly, and perhaps what distinguishes psychiatrists most from other mental health professionals, is that they can prescribe medication. Medications prescribed might include antidepressants, antipsychotics, mood stabilizers, or anti-anxiety drugs, depending on the condition being treated. Medications sometimes act as the primary treatment, or they can serve as an adjunct to therapy. In some cases, your psychiatrist may also offer psychotherapy. This isn't always the case, but many psychiatrists receive additional training in specific forms of therapy, such as cognitive behavioral therapy or psychodynamic therapy, and can provide talk therapy sessions alongside medication management. Another important role of a psychiatrist is monitoring the effects and side effects of medication. Medications, especially those used to treat psychiatric conditions, must be carefully managed. A psychiatrist will work closely with you to ensure your medication is effective at the lowest possible dose with minimal side effects. This might involve regular check-ins, adjustments, or in-depth discussions about how the medication is affecting your mood, behavior, and well-being. Finally, psychiatrists often work in collaboration with other healthcare providers, including therapists, primary care doctors, or social workers, to provide a holistic approach to mental health treatment. This might be especially important if you're receiving care from multiple providers, as coordination between your care team can help ensure that your treatment is comprehensive and integrated. Here's an example of how psychiatry fits into the bigger picture of mental health care. Someone who has struggled with lifelong depression may find that a combination of psychotherapy and medication yields the best results. A therapist might focus on helping this individual develop coping strategies to manage their emotions day to day, while a psychiatrist manages the medical side of things, ensuring the person's medication is effective and adjusting it as needed over time. So, when should you consider seeing a psychiatrist? The answer largely depends on your specific situation. If you're experiencing severe mental health symptoms that significantly interfere with your life, or if you've tried therapy but still feel stuck, psychiatry might be a crucial next step. Working with a psychiatrist doesn't mean you have to be on medication indefinitely either. The goal is always to optimize your mental health, with flexible and adaptive treatment plans tailored to your needs, circumstances, and preferences. All right, let's bring it all together. We've covered a lot of ground, so let's recap. If you're looking to explore your feelings, thoughts, and behaviors on a deep level, therapy might be the right choice. If you're seeking practical guidance or insights from someone who has already walked the path you're on, mentorship is ideal. If you want to set and achieve specific goals efficiently, consider coaching. A coach helps you clarify your ambitions, create actionable plans, and holds you accountable as you work towards your desired outcomes. And finally, if you're dealing with severe or complex mental health issues, psychiatry might be necessary, especially when medication could help stabilize your symptoms.